Sometimes we also recommend kidney care, and also cordyceps. So, what is standing out in this product is that it is for external use. It's not like the other products. This one is just for external use. So, if you are new to this program in Greenwald, and this one product you've never used or recommended, then it's high time, at least once we finish this training, you'll be able to know how important your bones are, and also how you can benefit from this product. So many people experience pain in one form or the other. Sometimes pain in the shoulder. They experience pain in their wrists, the neck, the back. People have waist pain. They experience this more so after sometimes long strenuous hours in front of probably in using a computer. So you may be able to have joint pain sometimes in the knee after you walk, probably for long, or even run. And when this one happens, what is recommended is that you need to pay attention to these symptoms, because they are a pointer to something is not okay in terms of our bones. So because of age, we need also to be aware that these conditions can become even worse. So that is why we need to pay attention when we start getting this kind of pains. And also, we need to know how to take care of our bones, protect them, as well as our joints. And it is very important for us, because bones, what they do to our body is that they are the bones and all the joints in our bodies. They are the ones that hold the flesh. They hold our body in place. So when we keep them protected well and working well, then we are sure we are going to have uh, a wonderful life. So we need also as well to know how they work. So bones, we are being told they are the frame under the walls of your home. They are like frames under, the structure of the building. So bones are your body's main form of structural support. Your bones are also living tissue like any other part of the body. They are not dead, so they constantly grow. Or, in essence, they also change and reshape themselves throughout your life. So, that is a very key point to note. People sometimes think that bones are not living. Bones are living, and they undergo a lot of processes during that. So, it's very, very important to take care of them. So, when we say bones are like frames under the walls of your body, of your home, then you want to picture, if you ever watched a home improvement show on TV, or even seen the internal structure of a house. So that's what your bones are. Uh, they support your body. They form the beams that keep your body strong and very stable. So we need to really take care of them, because they are living tissues, and it might not seem so much like it, but they are constantly growing and changing and reshaping themselves throughout your life. So that is a very key point to note. Um, so let's look at what bones are made of. And this is very important. Before we go into how we can be able to take care of them, we need to understand their composition and how they are made. So bones are made from three different kinds of cells. As you can see from your screen, we have osteoblasts, we have what we call osteocytes, and then osteoclasts. So these cells have different layers. have I mean, the cells have three different layers. Their general structure is a combination of protein called collagen and a molecule also called calcium phosphate. So these ones are woven together to form their strong, lightweight structure. And bones, as you can see from the three different kinds on your screen, osteoblasts, majorly, these ones, they make new bone tissue and help repair damage to your bones. That is the function of osteoblasts. Then we have number two, that is the osteocytes. Osteocytes, these ones are mature bone cells that help the bones of newborns to mature. That is the osteocytes. Then we have the third one, that is the osteoclasts. These ones, they break down your bones and help form them into their correct shapes. So each of these three different kinds of cells perform different functions. So you need to know that your bones have this kind of cells, and these cells are the ones that are responsible for the way the bones are shaped, the way they mature, the way they are repaired in case there is damage, and also the way they can be able to develop. That is mostly when somebody is growing up. So that combination, that is now the collagen and the calcium phosphate, when they are woven together, then they form the structure of the bone. So you can be able to see from that pictorial, we have the osteoclasts, that is the one that resorbs the bone. Then we have the osteogenic cell, that is the stem cell, that is the primary cell for bone formation. Then we have the osteoblast, that one forms what we call the matrix of the bone. And then we have the osteocyte, that is maintains the bone tissue. So let's look at the three main types of bones. So it's important to know before we break this one down that a normal adult has around 206 bones in their body. That's quite a number. And I think God created us in a very miraculous way. 206 bones in the entire body. And there are three main types of bones, as you can see from there. We have bones that make blood cells. These bones, they contain what we call the red bone marrow. So examples of these bones in your body, we have your pelvis. There's the bone called sternum. And then we have the humerus. And then we have the femur. So these are the bones that actually are concerned with the manufacture of blood in your body. And then number two, we have the bones that store fat. So essentially these bones, actually they contain what we call yellow bone marrow. It's not now red, but they have yellow bone marrow. The yellow bone marrow stores fat in the form of adipose tissue, and it can release energy when your body needs it in the form of triglycerides, a type of fat that is found in your blood. So that is the second type of bone that actually stores fat. We are always, as human beings, we are born. That is when we are born, our bones mostly contain red bone marrow. That is very key to note. But over time, it becomes yellow in our arms and legs as we grow. So this reflects our body's changing needs for blood cell production versus fat storage. So when we are young, mostly we have the bones that are responsible for manufacturing blood. But then as we grow, then the bones that are in our arms and the legs, they change and they contain the yellow bone marrow. And that one now stores fat in our body. Then we have the bones that form joints. This is another type of bone. So some bones come together with other bones. Ligaments, we have what we call tendons and cartilage in structures that are called joints. You know the composition of a joint. So joints is basically bones. We have ligaments, we have what we call tendons, and then we have cartilage. And these all form what our joints are made of. So joints support your body from head to toe. So whether it's a joint you are aware of, like, the big joints, you have your knee joints, ankle joints, you have waist joints, you have a lot of joints that you can be able to know. But there are some people that don't know that even the skull has joints. So the skull, even though it looks stationary, the skull actually has joints that hold them together. So all of the joints help us use our body on a daily basis. So it is important to know these kinds of bones that we have. That is the ones that make blood, the ones that store fat, and then the ones that actually help us to move our body in a good way. So we have common bone and joint conditions. We want to look at probably where the problem arise. Once we know what bones are, what they are made of, and then also what helps with their development, and then also the type of bones that we have, we need now to delve into some of the problems that even us as distributors and even our clients go through. So there are many different conditions that can impact the bone system, that is the skeletal system. Especially we are talking about your bones. And also it's important to note that your joints can be affected by anything that damages your bones or even the connective tissues, such as you can be able to see, we have what we call arthritis. So arthritis, we have two types. We have osteoarthritis. We are going to look at them one by one. And then we also have rheumatoid arthritis. Number two, we have a condition called periarthritis, referred to as frozen shoulder. If you have problems with your shoulder. Then we have cervical spondylosis, that is issues to do with the neck. Then we have what we call the tennis elbow. We have synovitis, that is issues with the hand. And then we have sciatica, and that is sciatic nerve pain. So we are going to look at them one by one so that we understand what these conditions actually are. So starting with arthritis, arthritis is basically a swelling and tenderness of one or more joints in the body. So it's a condition that affects the joints. The main symptoms actually of this condition are usually joint pains. We experience joint pains or some sort of stiffness of the joints. And sometimes these ones worsen with age. And the most common type of arthritis, as I've talked about, that is osteoarthritis and rheumatoid arthritis. So basically, you sometimes we get clients that complain about stiffness or even the fingers. The fingers are stiff. Sometimes they are folded. They cannot be able to straighten them. So any place that has joints will be affected in terms of this condition. So it's not basically probably the knees or any other part that has joints, but even where we have very small joints like the fingers. Then we have what we call, before I go to periarthritis, uh, or I want to point out that osteoarthritis causes the cartilage, that is the hard slippery tissue that covers the end of the bones where they form a joint to break down. So that particular slippery, when it breaks down, then somebody develops this condition called osteoarthritis. Then, as for rheumatoid arthritis, this is an autoimmune disease. Basically, an autoimmune disease is a disease in which the immune system attacks the body. So in this case, actually, this disease, your immune system attacks your joints. So when it attacks your joints, then it damages the joints, the cartilage, and the lining of the joints. So when that happens, then somebody develops what we call rheumatoid arthritis. Number two, we have what we call periarthritis or frozen shoulder. This happens to about 2 out of 5 people at some point in their lives. For the most part, it happens to those who are between ages of the senior citizens, that is of ages 40, probably to around 65. For some reason, we are also told that women are more prone to this particular kind of arthritis. Those who have diabetes or any other health condition such as overactive thyroid disease also seem to be at a higher risk. So, majorly, the part that is affected is the shoulders. And we can be able to note that at some point there are a few people who suffer this in their lives, and mostly it's the women that are prone to this, or even people who have particular conditions like diabetes. So you need to check. Once you are suffering from these conditions, then you need to really be careful because you may develop this. And when a client complains that probably they have issues to do with their joints or even bones, and they are diabetic, you want to clearly classify what kind of arthritis they may be suffering from. Um, let's move on to the cervical spondylosis. This is a general term for age-related wear and tear affecting the spinal discs. So this is majorly in your back. These discs that arise all the way from the neck down. As the discs dehydrate and shrink, signs of osteoarthritis actually develop, including bony projections along the edges of the bones. We call them bone spurs. So cervical spondylitis is more common and worse with age. We are told that more than 85% of people older than 60 are affected by this condition. So if you hear this particular condition and the ages are between, around 60 and over, and they are talking about issues to do with their spinal. Probably they've gone for checkup and, they've been diagnosed with this. You want to classify it as cervical spondylosis. So let's look at the tennis elbow, which is actually, we are talking about a condition that can result from overuse of muscles and tendons in the elbow. So this one actually attacks the elbows, that is now the hands. So despite this name, most people who get this condition, they don't play tennis. So let us not relate it to the sport. Some people have jobs that involve repeated movement of the wrist and the arm that can lead to tennis elbow. So you may be a fundi who uses a hammer most of the time. So as you strike the nail, you're using the wrist and the elbow a lot. So that particular overuse, the strike, the blows, you are a painter, the brush strokes, you know, people who are operating butcheries, you use your hand a lot, you use your elbow a lot. So that wear and tear may give you this condition called tennis blow. So don't relate it to somebody playing tennis. Of course, if you are a tennis player or you know somebody who is also involved in sport that they use their arm a lot, they also probably may suffer this particular condition. Then we have tenosynovitis. This is also common. More than half of people with rheumatoid arthritis actually develop this condition. And around 20% of people with diabetes they also experience it. Also, if you have had hand infections, issues to do with gout, we have COPD, or even undergoing certain cancer treatments, you are more likely to develop this particular condition. So this is also one of the problems that usually occur, and it occurs majorly on the hands. And then we have sciatica. This is also commonly seen as a problem. It is more common in males, that is of ages 18 and 35. So sciatica is a nerve pain from an injury or irritation to a sciatic nerve. Having sciatica means you have experienced mild to severe pain anywhere with nerves that connect to the sciatic nerve. So there's these symptoms majorly. They affect your lower back, issues to do with areas around hips, the buttocks, even the legs. Sometimes it causes a little bit of tingling and numbness also. Some symptoms may extend as far as down your feet and toes, developing depending on the specific nerves that are affected. So this particular condition, sometimes you hear people talking about pain that is traveling from the waist to the leg, is issues to do with the sciatic nerves. That is the one that connects the upper part of the body and your lower limbs. So your bones and joints can also be damaged by merely having traumas like falls or even accidents. And the most commonly seen injury is joint sprain. So when somebody is aged and they fall, then sometimes these particular issues arise. Somebody may have a hip bone, the hip bone is broken or dislocated, or there is a sprain. And then sometimes because of that age, then getting back one's stability becomes a little bit of a problem because now the bones are not growing so much at this time of their lives. And we are saying that when you have these conditions and experience some of these pains, especially when you are moving your joints, you have stiffness and swelling, and also sometimes inflammation of joints, then we need to actually, find out how we can be able to take care of this condition. So when you are suffering from these pains, or you have a client that is also complaining about these particular pains, then you can be able to classify it so that you know where is the problem coming from. Then you can be able to advise accordingly to be able to help that client. So we are talking about bone care plaster. And because bones are very important, then we need to know how this product can be able to help us take care of our bones, whether we are also looking at taking care of our clients' issues. Then we need to know what this product actually does to to these particular conditions. So this product we are talking about today contains about 16 ingredients. And these ingredients, as you can see from their names, are of Chinese medicinal origin. So Greenwald Bone Care Plaster can be a good product addressing the symptoms caused by the above mentioned health conditions. So we have uh, uh, this particular uh, ingredients. We are not going to talk about what each of them does, but we are going to talk about what they do as a block. We have the first eight. We'll be able to see what they do and then what the other part also will do. So according to the traditional Chinese medicine, that is a TCM, there are four main exogenous pathogenic factors that affect human body and cause various health conditions. So number one, we have wind. Then we have dampness. Then we have what we call cold. And then we have heat. So those are the four main pathogenic factors that affect the body that result in the problems that we have. So they are responsible for rheumatoid arthritis, they are responsible for osteoarthritis, cervical or even lumbar spondylosis, and sciatica as well. These pathogenic factors, therefore, they can cause tingling, heaviness, swollen, stiff, and numb limbs, and even joints that are swelling with a red color and a warm burning sensation. Weakness of muscles and joints, and then also people experience difficulty with moving and walking for a long period of time. So these ones are majorly seen in cold, humid, and windy places among people who are weak in defensive qi. So we are going to know what qi is. It's written QI, but it's read as CHI. So qi in TCM represent the essential energy that sustain all living things, or immunity due to poor constitution of weakened health conditions. So so chi now is the energy that is sustaining our lives. So as soon as pathogenic winds, what we call cold, heat, or dampness, invade the body and have passed the superficial region, they may obstruct this energy from moving well in our body and also obstruct what we call blood circulation in the meridians and cause a lot of pain associated with muscles, our joints, and also other regions. So out of the four, the one that is predominant is the wind. These symptoms show a moving feature, such as pain migrating from one place to another. Tingling, we have spasm, and then we also have twitching of muscles, and sometimes the skin is itchy. So when you have a client that is complaining about something traveling in the body, probably from the waist going to the legs down and coming back, you want to classify it as associated with what we call wind. So in conditions where cold is predominant, we are talking about the four factors, the four pathogenic factors. In conditions where the cold is predominant, pain is severe and worsens in cold weather. So if you have a client that complains about joint pain, majorly in cold weather, then you know the predominant condition here is cold, right? So we've talked about wind, we've looked at cold. So you'll be able to classify where the client is talking about. So you can be able to help the client accordingly. Then if dampness is predominant, The symptoms show a heavy and lingering feature. For example, somebody may experience chronic heaviness and swelling of limbs and joints, chronic itchiness and weeping skin disorder. So if somebody talks about the joints are swollen, then you know the predominant pathogenic factor here is the dampness. There is a lot of dampness and inflammation in that particular joint. That is why it is swelling. And then the last one is heat. If heat now invades the body, it may obstruct the meridians and cause swelling of the joints with red color and a warm or burning sensation. So when somebody explains about or complains about, the legs are burning, we've we've seen clients talking about they have to keep their feet inside the water to probably lower the temperature. So the pathogenic factor here, according to the TCM, is the heat. So that heat is what brings that burning warm sensation. And then there is that red color on the joints with that swelling. So it's important to know how to classify whether it is wind, whether it is the cold, whether it's the dampness or the heat. But we are talking about they are expressing in different forms, right? So when these pathogenic factors have remained in the body for a long time, it affects the kidney. It also will affect the liver. That is why sometimes we recommend these clients also to use, kidney care. And sometimes also we recommend that they use a liver gen. So the chi and the blood may coexist with the exogenous pathogenic factors we've talked about. When these muscles and joints are not nourished and supported by the chi and blood, they become weak, they become stiff, and they also become numb, and the skin disorders may become recurrent and very chronic. And more so if the kidney and the liver are injured, patients will suffer from stiffness of joints and deep pain in the bones. This can lead to difficulties with moving and also walking. And that is why when people have bone and joint problems, as I said, we always recommend kidney tonifying capsule. And then sometimes also we recommend Hepatio capsule or Livergen. I believe what we have in this market is Livergen. So as far as we recommend those other products, we also recommend bone care plaster for external use. That is why we are looking at this product today. So this product helps to dispel the pathogenic wind. It helps to dispel the pathogenic dampness. It helps to dispel the pathogenic cold, to ease pain from the bones and the joints. So the following ingredients in this product actually help to do this. So what I've talked about, all the dampness, what you can be able to see as the ingredients in this product put together, they work to, dispel the wind, the dampness, the cold, and the heat away from your body or away from your joint so that your joint can be able to function well. So then we have the second batch of ingredients. And we are talking about now something else. We talked about TCM earlier on and the Qi. Now here we have a word called BI. So BI in Chinese means an obstruction. And a B syndrome refers to the syndrome characterized by obstruction of qi and blood in other meridians due to inversion of the pathogenic wind, cold, dampness, and is always manifested as soreness. We have pain, we have numbness, swelling of joints, and limitation of movements, and so on. So as the joint is one of the most common symptoms, as joint pain is one of the most common symptoms in the B syndrome, some Western doctors often refer to it as arthralgia syndrome. And this one includes, we've talked about rheumatoid arthritis, we talked about osteoarthritis, and then we have gout. We know what gout is. That is a swelling of the big joints of the toe, probably of the hand also. And then we have fibrositis and then neuralgia. So Chinese medicine practitioners always use herbs to invigorate blood flow, that is that blood circulation, and remove blood statis to relieve swelling and pain. So these herbs include the ingredients in the bone care plaster. So these are the ingredients now that help to remove the blood stasis and to relieve a lot of swelling and pain, right? So the first batch we're dealing with the four pathogenic factors, but now we have the next batch dealing with now removing blood stains and also uh, relieving somebody of the swelling and the pains from these particular joints. So we also have a number there. They're about 10 to be exact. So in total, that is what they do. They just invigorate blood circulation, remove blood statis, and then they relieve the swelling. And the other one was dealing with that batch of about 9 ingredients were dealing with the wind, dampness, cold, and then the heat. So that is how they are classified in that product. So this particular product, let's look at who is suited to use it. So before we look at this, I want to point out that, sorry. So except for people with arthritis, Greenwald Bone Care Plaster is also suitable for people with what we call ankle contusion. We have lumbar sprain, as you can see from the picture. So ankle contusion, it affects your ankles, the ankles of the feet. That's a joint down there. And then we have the lumbar sprain. That is your lower, probably somewhere around your back and your sides. Then we have the lower back pain. And then we have the shoulder stiffness. And then people also suffer from cervical pain. Can be able to see from the pictures there. And then we have the lumbar disc injury. That is the central one. And then also people suffer from what we call wrist sprain. Issues to do with the knee sprain. And then what this plaster does is that it relieves the swelling and the pain. So that is the main function of this particular product. So sometimes you receive clients that tell you when they have joint pains, mostly conventionally, what they provide is what we call painkillers. That is the essence, because people suffer a lot of pain. So when they go to the hospital, because there's nothing much that they can give, sometimes they just offer painkillers. People start with diclofenac, and sometimes they also use The ones that are, the ones that are a little bit milder, they will start with things like diclofenac. But when the pain now is chronic and a little bit heavy, then sometimes they recommend that the client now uses a stronger painkiller. Sometimes even they use painkillers that they recommend painkillers that people with cancer use. So that is the modality. And we are talking about bone care plaster being a natural product that you just paste where there is pain, and you know, it absorbs that dampness and then relieves swelling from that joint or from that part of the body, and also take care of the pain. So somebody who is prone to uh, using a lot of painkillers, we can recommend that they start using bone care plaster, because it will be now a little bit easier on the body, because also a lot of painkillers, we are aware that is the cause of ulcers to most of these old age people. So we want them not to continue using a lot of painkillers that will also bring other pains and other conditions in their body. So this product is very easy to use. It is quite simple to use. What needs to be done is you cleanse the skin. The area where the plaster is supposed to be pasted, you cleanse that area with clean water. You may use clean, warm water. And then remove the release paper and stick the plaster on the painful joints and the tender areas. So here you need to make sure that the skin is intact with no injuries. So advise the client, or even if you are the one who is using it, don't paste it on a wound. If there is a wound around the area where the joint has a problem, please don't paste it there. Don't put it on broken skin. The skin is supposed to be intact with no injuries. So each piece of this plaster can be used for 2 to 3 days. There are 10 inside the pack. So you advise the clients not to throw away whatever they've used in a day, because they can use it for several days. And the interval time for plaster change is 4 to 6 hours. So if you have a problem, the client has a problem with the knees, then they will paste one on the right side and then wait for between 4 to 6 hours, change it to the next knee. And now if that is already done for the day, they can keep it and then repeat using it for the next 2 to 3 days. So it will serve them for long. It's important to note that, so that they can be able to use it well. So let's look at some of the health tips we need to also look at. We should also keep in mind that the best way to take care of your bones and joints is to maintain good overall health. And here we are talking about following a diet that is healthy for you. So this diet may include milk, cheese, we have dairy products, we have green leafy vegetables such as broccoli, we have cabbage. Then you can also feed on soya beans. You can get nuts and also fish. So these ones are good for your bones. So you need to feed on this diet. So kindly limit alcohol and caffeine. Limit alcohol and caffeine. If you want to prevent getting these particular conditions, or if somebody is already suffering from this, you need to advise them. It's not about just using the products or the supplements. They also need to check whatever they consume. So a lot of caffeinated drinks like sodas, canned beverages, those ones contain caffeine. And also, spinach is a good, it supplies calcium, but it has a lot of what we call oxalic acid. So it means for a person that is suffering from issues to do with the bones, when they consume spinach, the oxalic acid will prevent calcium absorption. So as you do your green leafy vegetables, please don't use spinach because it will prevent your body from absorbing calcium from the supplement you are using. So do your exercises, keep moving, don't be sedentary. Everyone bodies, they are different in terms of what you can do with them in terms of exercise. There is cycling. Some people do strength training. It depends with the body. You can do your swimming, low impact cardio, water aerobics. There are a lot of options that you can, but depending on your body, how you are. So which type of exercise is best for you is depending on your joint health and fitness level. So you cannot force somebody who is 85 probably to be doing strength training may be a little bit heavy for their joints. So they need to choose what they can be able to do to help. So you talk to your provider about which physical activity you can do to enable you develop proper joints. And then you need to wear protective equipment as you do your activities, you're working, or even you are doing an activity, you are doing your exercises, you need some protective equipment. Majorly, if it is the joints, you need to something to protect the joints. You also need to, we are recommending that you visit your healthcare provider for regular checkups when you notice some of these problems that we talked about earlier on. So it will help, nip them in the bud before they go overboard. And then when traveling, please, you always make sure you wear a seat belt. This one can possibly reduce the impact in case there is an accident so that you reduce chances of a lot of injury. So those are the tips that you need to, you know, inculcate in your daily living when you want to prevent these conditions or you are suffering from these conditions. So as you give these products and as you also give this product we are talking about, that is the joint health, I mean the bone care plaster, you need to advise your client on this. Don't just give them and leave them to go. Let them know how they're supposed to take care of themselves at home. It will bring more benefit. So in summary, bones gives our body support. Bones allow us to use our muscles to walk, to ride bikes, even holding a child for a mother. They protect our organs and also store and release our supply of calcium. Calcium, as we know, is a mineral that is very necessary not only for building and maintaining strong bones, but also for the functioning of all the cells in the body. So I want us, as members of Greenland and whoever who is in this forum today, to begin 2026 with an intention to build better bones through Greenwald supplements and products, because we know the bone is everything to the body. When it has a problem, then you find that the whole body suffers. People become very mobile. I got a call from a client today that was talking about they've had a lot of bone problems that now they are, bedridden. They are taken out and brought back into the house simply because it started, but they didn't do anything about it. So now it has reached a point where their mobility is impaired and they cannot move totally because of bones. So that one tells you what bones are, why we need to take care of them, and why we are grateful for Green One for having these wonderful products that can be able to feed our bones so that our cells can be able to work well. So thank you so much for listening. And I want to wish you well in this new year in terms of taking care of your bones. And may all of you stay blessed, and may God richly also keep you successful and keep you so much helpful in this particular program that we have through Greenwald. So that is the end of my training. I want to take this one back to the host, Mr. Fred.
Thank you very much, Eric, for that wonderful presentation. You have done this product or this topic justice by the elaborate explanations on, first of all, the body, the joints, the bones, the tissues. You've also talked very nicely about the product itself, the ingredients, and how the different ingredients are able to help the body and solve the issues. So thank you very much for that. I hope that those who are listening have been able to learn a thing or two that they didn't initially know about this product. This product for me has been godsend because uh, I have from time to time had issues with back pain, especially in my lower back. And I normally carry it around. I normally carry it around because it has helped me a lot. I remember when in 2024 we were in China, and one of the tour guides twisted his ankle, uh, and he was in so much pain. He was limping, and actually, the bone care plaster that I had is what came to his rescue. But you see, when I was giving it to him, he wasn't even sure that it was something that could help him. So he took it, you know, uh, he was ish. He wasn't so sure. But he decided, let me try this because he was in pain. And now the problem is because he was taking it and he was not so sure, he didn't even mark my face. So he took it, put it on his foot at night. The next morning, now he was looking for someone who gave him something that helped him a lot, but he could not remember me. So, but that is the funny part of it. But this product is really a good product that you can use to alleviate those joint, bone, and tissue pains that people suffer from. If you are in engaged in physical activities like sports, you should have one pack in your bag, because you could need it, and it is one thing that can help you a lot without leaving you with the side effects that the sprays and the massage ointments sometimes have. So we have come to the end of the training tonight. I just want to wish you all a good night. Wonderful weekend ahead. See you again next time, and get yourself that pack. Um, get your old ladies, your fathers in the village. Sometimes we talk about these products just as products that we want to sell, but they are products that can also change the situation in your homes. They can improve the quality of life for your loved ones. So don't look at them just as products that can bring us money, but also products that can reduce discomfort for our family. I think I don't know whether I saw a question in the chat box. Eric, you've seen a question there. There's
Yeah, I'm seeing somebody talking about in case of the wind one, where do you place the plaster? When we talk about wind, that pathogenic factor, we are talking about people experiencing pains that sometimes travel. So I talked about a client telling you that something moves from the waist down to the feet, right? So one, when they feel that traveling bit, then there is a place where the pain stops before it again feels like it is traveling back. So you want to place it where the origin is and also where you feel it ends, right? So that you can be able to take care because once it travels, the traveling does not cause pain, but where it rests before you feel like it is moving back, that is where you need to place that plaster. So if it is the hip, that is where it's originating, please place, advise the client to paste this there. And then when it's where it ends, they can now transfer after that 4 to 6 hours. Somebody talking about can it treat migraines? We know the causes of migraine. As far as we are talking about, this one can be able to ease pain. We are talking about joint pains. Migraine is not classified as a joint pain. It may be a cause of some other issues in the bodies. Probably somebody also not the body is dehydrated. So when somebody has a lot of migraines, you need to know the source, what causes the migraine. It is not an issue with the joints. It may be stress related, it may be dehydration, it may be circulation is not in order in terms of, migraines is basically the head. So probably there is some sort of obstruction in the circulation that brings those kinds of things. So when you have migraines, get to know the cause. And this one may not be a solution to it. Probably pasting it may give you relief of pain, and that one need to be substantiated at the end of the day. But get to know the cause of that migraine and then sort it out. This one is majorly for that is why we call it and bone care plaster, not for issues with migraine. Then I'm talking about what about restless foot syndrome? People keep on, I want to believe this is you sit and you keep on shaking your legs, huh? Some of it, I think, is behavioral in nature, and some of this also it's in some of the lineage. You may be in a family where people, constantly they are sitting, but they feel like they are restless, just shaking the legs, right? So we need also to know where that one is coming from. So in terms of if it can help, probably we need to find out more even from the source so that we can be able to advise accordingly. Thank you.
okay. Thank you for that. I hope those who had questions have been properly answered. If you feel you need more explanation, you can reach out to us, and we will try our best to give you the best answers and the best solutions to the questions that you raise. So as we end, I've seen someone, I think Mr. Okuta has asked about the recording for the video. You can visit our YouTube channel. I will upload it there. So you will find also other videos of trainings that have happened before. You can constantly be watching them and relearning maybe what you missed. Asante sana. Wishing you all a good night. Sleep well. Uh, See you again next time.
Good night. Thank you all for your attention. Good night, George. Good
You've
night, Fred.
you've all been unmuted. You can say your goodbyes and your good nights as you part.
Good
See
night,
you
Eric.
another time.
Thank you so
Good
much,
night,
Good night.
George.
for the
Good
Good night,
presentation.
everyone.
Eric,
Good night.
asante
Good
sana
night.
for
Good
the
night,
input.
everyone.
From
Good night.
Canada,
Good night.
I I don't know
Thank
whether
you.
it's night
Thank
there,
you.
but hello to
Julius,
Yvonne.
good
Hello
night.
to
Hello, hello.
our
Thank you.
sister
Good
Happy.
night.
Good
Good
night.
night,
Hello,
Dominic.
Good
Yvonne. Thank you
night. Good
from
Thank you.
night.
Canada.
Good
Good night,
night.
Fred.
Good night. Good night, George. Betty
Bye.
Mount Kenya. Good night.
My
Good night,
friend.
Eric.
Good night,
Good night.
everyone.
Good night.
Kevin
Good
Deda,
night,
good
Uncle.
night.
Charles Onyango.
Tawa. Good
Good
night.
night.
Good night.
Kevin
Thank you.
Deda, good
Okuta
Good
night.
night
Petros,
to
I think you're
everyone
the
here.
one who was asking. Please check our YouTube
Night.
channel.
Yes.
Bwana Julius Kiragu. Good night.
Okay.
Good
I will
night,
check.
Kevin Deda.
Madam Leah Waudi. Good night.
Good night.
Ruth
Good
Naingi,
night.
good
Good
night.
night.
Seronei Nakuru. Good night.
Okuta, good night. Salasia, Peter
Good,
Salasia, good night.